The Genetic and Rare Diseases Center estimates fewer than 5,000 people have hereditary connective tissue disorders in the U.S. However, doctors say the syndrome is likely underdiagnosed because of how rare it is. Our medical reporter Elizabeth Shores spoke with a Mandan woman about her experience with the disorder.
Vicki Newton has had problems with her joints for most of her life. She wasn't diagnosed with her degenerative connective tissue disorder until 2013 when her then 7-year-old son's retina detached, and they took him to the Mayo Clinic.
One of the physician's assistants out there noticed some body characteristics that are indicative of Stickler syndrome.
A genetic test confirmed the clinical diagnosis for hereditary degenerative connective tissue disorder. Vicki says she stays at home a lot because she's in pain most of the time and she has trouble walking. Her 2 therapy cats, Luna and Garfield, keep her company.
And it has stimulation on or off.
The pain recently spread from her legs and spine to her hands and fingers. Her son inherited the disorder as well, but for him, it's mostly affecting his eyes. Years ago, Vicki's doctors implanted an electrical stimulation pack into her back. She controls it with this remote. When she turns it on, the pack vibrates, easing the pain in her spine. She says nobody else can feel it, but her cats do occasionally sit on her while she has it on. She says when she does go out, people often judge her for using things like a motorized cart at the grocery store.
I get glares. I get people that look at me and wonder, your age and you're healthy, you look healthy. You don't. And I know there's a lot of people out there, but not all disabilities can be seen.
Unfortunately, it can be difficult for people with these kinds of disorders to be diagnosed because they're so rare and can vary so much. Genetic counselor Kathleen McCann at Essentia Health in Fargo says just having 1 or 2 of the symptoms doesn't necessarily mean you have this disorder.
We started discovering when we actually could do genetic testing that people in these families, people in the family could have 1 of 6 or 7 characteristics, none of 6 or 7 characteristics, and have a mutation.
There's not a cure for Vicki's disorder, and she hasn't met anyone else with it in the Bismarck-Mandan area aside from her son. She hopes she can get a surgery in the future that will help with the pain in her nerves. It will depend on whether or not she can get her insurance to cover it. In Mandan, I'm Elizabeth Shores reporting for Your News Leader.
She is.
McCann says if you were diagnosed with a similar disorder decades ago, it's probably worth it to have a genetic test done to confirm you received an accurate diagnosis.